Welcome to the Homegrown Heart Podcast every Friday at 7 a.m. with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and an expert in her field. This week's topic, Aortic Disease Awareness, a conversation with Brittany, Rhodes, Gilda Martinez, and Summer Gonzales. Right now, here's your host, Dr. Amanda Ryan.
This is our weekly podcast here from Carlsbad, New Mexico. And we have the specific purpose of educating our Southeast New Mexico residents and further. I know I kind of heard an interesting story from one of my great aunts last week that my great grandmother on that side actually had PAD that I wasn't really aware it had both legs amputated. So she was telling me that she's like, oh, my husband and I are listening to your. I thought that was so interesting. Then she's like, I don't think you realized, but your great grandma actually, had both legs amputated. My aunt is a caregiver and she had cared for her. And then her husband, who's 60, needs open heart, 4-vessel bypass. And so she's like, I told him I was listening to your podcast and you said this. So I think it's really, when we're trying to figure out how to reach a wider population, so I think this is a great way to do so. So this is part of the purpose of our podcast. I want to kind of say, so who do we have with us today? Brittany, Danielle, introduce yourself.
Hi, my name is Brittany Rhodes. I am an advanced practice nurse, clinical nurse specialist from Houston. I have been working here at Baylor College of Medicine and Baylor St. Luke's Medical Center for the past decade. And I'm excited to be a part of the Division of Cardiothoracic Surgery here at Baylor College of Medicine now.
And I'm Gilda Martinez. I'm a nurse practitioner also. I think we've both worked here the same amount of time. So for the past decade, here with the Baylor College of Medicine.
Great. And Summer?
My name's Summer Gonzales, and I work for Dr. Ryan, but I am also a aortic disease survivor.
Wonderful. And let me just give a little shout out to Tammy Wacker from our team who helped get this all coordinated. I appreciate it. I kept meaning to, but days go by quickly and you don't always get everything accomplished. The days of checking everything off our to-do list seems to be a little bit limited. And also to Danny Fletcher, who edits our podcast and is our producer. He's amazing. He's able to really make a lot of edits when things don't go exactly as planned. And then Dr. Barron, who you guys work with. And Dr. Barron, again, is a cardiothoracic surgeon with a specialty in aortic disease, right? And she trained at WashU in St. Louis, where my sister is one of the lead OB nurses. And, they call it the big house for a reason, because you're seeing all comers there. And I'm no doubt that her training was excellent. I just met up with her at a conference in Boston too, where she was one of the leaders putting on a kind of heart disease in women awareness about different pumps we use and heart failure and stuff, which was great. But we kind of came to know Dr. Barron by accident. Summer, why don't you tell us a little bit about how I met Dr. Barron and you did?
Yeah, October of 2022, my Nana had a dissection. Stem to sternum, she really wasn't going to make it. She was in between El Paso and Carlsbad, and they drove her to El Paso, where 2 hours later they found out that she had dissected, and they told her Dallas or Houston. And she was just kind of like, oh, I don't know, I guess Houston. So she chose Houston, and she was air flighted there, where Dr. Barron did a 6-hour surgery to save her life, and did. And then it wasn't a year later, I want to say, that I had to have my own surgery. And of course, I reached out to Dr. Barron for that.
Excellent. Can you tell us a little bit too? Your grandmother, Nana, is an amazing woman, first of all. So we're gonna owe it to her for connecting all of us, yes. Right? So that's been truly amazing. She was 62, I think, when she had the dissection. Early 60s is what she is. And it's interesting, that's the first significant health issue I would say she's had. Do you think that's fair? She's had several challenges since, but why do you think that is, Summer, as far as, and Brittany, Danielle, you guys can all kind of chime in. as far as like when we might express some of these and what made us think there might be something more to the story than just in regular quote unquote aortic dissection, which is never regular.
Yeah, she was pretty healthy her entire life. My mom, who was in her 40s when she had to have her first surgery for a big aortic dissection, had a doctor who felt like it was kind of odd to be that young with such a big aortic aneurysm. So they did some connective tissue testing and found out that she had Loeys-Dietz. And so through her testing positive, her entire family got to test. So of course we all tested and all came back positive. My Nana had no symptoms. She was very healthy. She was working like a dog still, you know, driving bus back and forth between Carlsbad and all our surrounding areas, and just randomly one day pulled the brake on her bus and dissected.
And I think important to say there that we had checked a coronary CT on her to check her aortic root to see what was the size. And it was 3.4 the last we checked. And so I remember talking to Dr. Barron and just saying it's kind of crazy, like her blood pressure was low. The last root we had within a year was 3.4. So with aortic disease, and do you guys want to talk a little bit about what's different in someone that has an underlying connective tissue disease?
So with aortic disease, one of the things that we recognize is it affects individuals all ages, stages. You know, sometimes individuals present early and sometimes individuals don't present until later in life, in their 60s, sometimes even 70s. So anytime, like to Summer's point, we see someone that presents early, you know, we begin to get very suspicious and very aggressive with it. You know, as far as family history assessment, we really want to know what the overall picture of the family looks like. And sometimes that becomes a little complicated because individuals have family members that they don't necessarily know how they died, or they don't know what kind of, you know, we don't talk about our health with all of our family all of the time. So sometimes it requires a little digging and some very specific questions. But once we have an understanding, or we know or suspect someone has a connective tissue disorder, then we become very aggressive with the monitoring, because we know that those individuals, their aorta doesn't behave like a normal aorta. So individuals that are having monitoring may have a rapid growth. So that is something that we see. So it's not only important for individuals to be monitoring regularly, but really paying attention and letting all their healthcare providers know that they do have an underlying condition that may affect it.
I agree. I think the traditional aortic dissections, which, like I said, I don't know that there's traditional as far as symptoms or really background. But, you know, what we're taught is that it's the classic poorly controlled hypertensive patient that comes in with stabbing 10 out of 10 chest pain that goes straight through to their back. And I will say, from an emergency standpoint, you know, everyone doesn't read the book. So I think only a third of patients actually present with pain that really goes through to their back. I know I had one aortic dissection that we did miss for a while, and throat pain was the only real symptom. It was so strange. As a matter of fact, when you read about it and learn, you know, they call aortic dissections the great masquerader. And I think the point is just to have a very high index of suspicion with that. I think one thing that, and I'm jump around a little bit, everyone who follows my podcast is used to that. So we don't have a script. We just talk about different things. But I think, you know, the collaboration with rural physicians, right? Summer is a big advocate, as well as Tammy, for really how do we patients in a rural area compared to our urban and suburban areas, and how do we make sure that we make those connections? So I think you ladies are a wonderful example of how we can help connect those. You know, Summer connecting with you guys on different patients. We've already been able to send you guys some different, some other patients. And I'll be fair, I consider myself well-trained, but I became more informed on aortic disease and aware because of Summer and her family, and my desire to help her stay living in a rural area. I didn't want her moving to Houston or Salt Lake City, either one. Okay. So
Right.
I have a selfish reason here in Carlsbad. No, and people say that. Even I've said that. I'll be fair sometimes about my genetic patients of a different. Well, if I had that, I wouldn't be living in the middle of nowhere, New Mexico. But that's easy to say. But when this is home, I mean, it's difficult sometimes to just pick up your life and move to the next location. There is a lot of economic opportunity out here. And from a health standpoint, it's so underserved that if every person involved is like, well, I'm just going to move to a big city so I don't have to, because we don't have the resources out here. That's just not realistic for everyone. It's not realistic financially, and it's not really, we've got to find a way to reach our rural population. And I think these collaborations are they're very important to us being able to do that. So I think, and again, we have so many options now. Team, Zoom, we can do a lot of educational stuff. One thing I want to ask you guys, and Summer's been a real advocate for the genetic testing. If you guys do have a family that's involved and you kind of suggest genetic testing, people have asked me what are you recommending on the genetic testing front?
We try to meet the individuals where they are. Sometimes we have aortic patients that come in and they are, even with a mild suspicion, they're very, proactive and they want a genetic test. And so we try to recommend that, for most of our patients that come in for an aortic clinic, we're able to provide the documentation to help support that. I believe the coverage for genetic testing is improving, so it's making it more widely available for individuals that may have not had that option for coverage in the past. But sometimes individuals want to delay for one reason or another genetic testing. So we try to be very respectful of that. We are happy to connect those for testing that want it. But anyone that we suspect may have an underlying connective tissue, we'll treat them as such until genetically proven otherwise.
Yeah, I think that's a very good point. Summer, why don't you say what happened last week? Remember with the Aflac and some of that stuff, that was a little bit of an eye opener, especially at your age.
Yeah, definitely. I did just want to add on the genetic testing, through Invitae, who I did the genetic testing with. Once one of our family members was positive, after that, within 90 days, all of our family members were able to test for free. So that was really helpful, for people who couldn't afford it, or somebody who, say, didn't have health insurance, things like that. So I felt like that was really a step towards trying to really diagnose it. But as for Aflac, so we had the Aflac rep come in to offer like life insurance and short-term disability and those type of things. And of course, it's individual to that person. So she starts running my information and asking me medical questions, and I pretty much was disqualified from almost all of them based off my medical history. She's looking into trying to get me a special life insurance plan because I just truly don't qualify with already having aortic open heart surgery. So it was disappointing. She was like, I've never talked to somebody at your age and had to tell them like they don't qualify for any of these amazing programs. So it was an eye opener for sure.
It is. And that's part of the thing with genetic testing, whether we're talking about aortic disease or anything else, that I kind of tell people. I mean, there's pros and cons. You have to mentally be prepared to handle it.
Yes.
And you also, it will have financial and insurance coverage implications for your future. And while large group policies can't deny you because of it, individual policies can. And it really does. Why don't you say a little bit about your journey, Summer, from maybe getting tested, your mom being very involved and learning about Loeys disease, Nana kind of, being in the middle. And I think you were on the other end of the spectrum. Like, I don't want this disease, I don't want to deal with it. I'm healthy, I'm fine. And I'm not really going to think about it.
Yeah. I tested in 2020. So that was, I really found out I had Loeys disease a month before COVID kind of hit. And my mom, who had found out she was positive and had her surgery and got all, kind of was the advocate for the family to get everybody tested, because all of us were kind of like, oh, like, we're all young, like, what do we need to test for, But she really pushed us to do it, and so we did. And when we all came positive, she was, she had reached out to her doctor and was on the Lois Dietz Foundation and things like that. So she knew a lot of the side effects and things that we should be checking up on yearly. And so she was pushing us like, you need to get a CT scan, you need to get an echo, you need to go get your eyes checked, all this stuff we needed to do. And I was just kind of like, well, I'm in my 20s and I don't think anything's really going to happen this soon. I think it's kind of rare. I'm really not going to worry about it. So for 3 years, so she pressured me and Dr. Ryan a little bit. So I did get my CT scan and my echo, and everything was normal. So for the next 3 years, she was on my butt every year about trying to get me to do scans and get echoes done. But honestly, financially and, just being busy and thinking that it wasn't going to happen to me, I really put it off for 3 years. And I didn't really make it a priority of mine until we had gone private and we were kind of thinking about insurance plans, and our practice was small and the insurance plans were expensive and I really didn't want it. I was like, no, I think I'll be fine. I'm pretty healthy. I don't have any issues. And I remember Dr. Ryan saying, no, you need to get the insurance. Like there's no way you can't get it. So I got it. And it wasn't even 4 months later that I was like, okay, since I have it, I'm going to use it. I got my echo and a CT scan and found out that I was having surgery 2 weeks later.
Yeah. So. All while developing a cardiovascular practice out here that included an ambulatory surgery center, by the way, which has making for all of us. So while being an aortic disease fighter and a rural healthcare advocate, summer is also getting this going. So high deductible plans, crazy busy, and again, then even we kind of got the echo and I didn't look at it for a couple of days because, there's 8 million things going on. And then I was kind of like, I looked at the echo. I was just like, I saw that a root was a little bit larger, but I still didn't meet classic criteria for needing to be fixed. So I was kind of like, well, I don't know, let me see. And again, the CAT scan then initially was just read as like, no dissection or enlargement of the root. We had to ask a couple times. I measured the root and I did think it looked enlarged. We ended up sending the CT to Dr. Barron, who also looked at it and was like, no, it looks a little bit enlarged. And that's when she really explained to me how the tissue of people with aortic diseases such as Lois Dietz, Marfan's, etc., it's just that the tissue is so different. She's like, it just like the tissue in your hand just kind of, it just can kind of split. It does not respond the same way that normal aortic tissue responds. And so she's like, you really have to have this higher level of suspicion. I mean, Nana then had a stroke and her carotid started dissecting further. And she was at UMC in Lubbock that time. And she ended up getting 4 carotid stents placed. I mean, I've been doing this a long time. I know I look young, but I'm older than you. Just kidding. Anyway, I've been doing this a long time. I don't know anyone that has 4 carotid stents. I was like in the same artery. So and she was like literally having a stroke during the procedure and after. Of course, she made 100% resolution again because she's just touched by the hands of God and it just has a way of recovering. And is doing it. She did our cardiac rehab program, which I think is so important as well. I just think there's so much room for awareness, for early and education of providers. I mean, I remember Summer's mother too. She was driving down the interstate in Utah when she really had a STEMI, so an acute LAD dissection is what she really had. The woman, she's never smoked. She has no high cholesterol. She has no traditional risk factors for coronary artery disease whatsoever. And I remember the doctor, the interventional cardiologist there, which no disrespect. Again, I do not know everything. But they were like, oh, it's not related to your Loeys disease. That condition has nothing to do with this. And I was like, yeah, it does. She had what we call SCAD, sudden coronary artery dissection. She did not have a classic atherosclerotic acute cardiac event. She had an event because she has underlying connective tissue disease.
Yeah.
That can happen in women postpartum, whether they do or don't, that in that kind of area. But again, as long as our training is, we can't, it's hard to extend it, but you can't really be exposed to every single thing either. So I think, having conferences and aortic disease awareness, groups, the foundations that, we just have to connect and spread information and awareness in any way possible. I mean, I think that's the biggest thing. And I think, again, Brittany and I had kind of talked about the importance of having advanced practice APPs that are specifically focused on this too. And because again, sometimes I see this in my practice, I'm sure you guys say, oh, I want to see Dr. Ryan, I want to see Dr. Bear. I mean, I understand that, but we're one person. And I always say we need everybody working to our highest level. So our highest level is operating. It's doing emergency cases. And yes, sometimes it requires a little bit of discussion with us. But when we can educate our team further and get highly skilled people as part of our team, I mean, I say every day, this is not Dr. Amanda Ryan's practice. This is Advanced Heart and Vascular Center of New Mexico. It is Advanced Surgery Center of Carlsbad, New Mexico, meaning this is a team. And I am just one part of that team. And I know you guys feel the same way. We have to empower people to realize that a highly trained physician is just a leader of a team.
To your point, Dr. Ryan, we found that when we came over to aortic surgery, after many years of cardiac experience, we were not aware of what to look for connective tissue individuals that were walking through our doors. We were unaware of what medications, like how to best manage these individuals if we did identify someone. So even being in cardiology as an advanced practice provider, there was a real knowledge deficit. And so we're working very hard to eliminate that and make cardiology nurse practitioners and APPs, as well as family medicine APPs, aware of this. A lot of times these individuals may not have, if you're in your 20s, you cardiologists. So those individuals may be walking through the door of primary care.
Definitely. They may never reach, our level for sure. I think our feed might have broken up a little bit with you guys. Sorry, Brittany. I think our feed broke up just a little bit with you.
Can you hear us?
Yes, now I can.
Okay. Yeah. What we were saying was that, we did find that we didn't have that experience. There was that knowledge gap, and it's what made us or drives us to continue to learn and work with all of these patients. And we've seen patients with these connective tissue disorders of different ethnic backgrounds, which is not typical what you find in the literature, right? And so we've been working hard to try to come up with educational information for, all our counterparts, all the APPs in cardiology, get the word out there, get the information out there so that we can better service our patients.
That's great. And that's just a good example of, I think, where sometimes, really remembering that the population is it's broad and it's very different. You kind of get in this mindset that this person is who is at risk for this disease. And then you realize, I remember just, rheumatoid arthritis I trained in a primarily inner city, very much African-American and Caucasian population. And when I came out here, I started seeing a peak of lupus and RA in some 55 to 65-year-old Hispanic men. And I was like, I didn't even really know. They had chest pain and they had some pericarditis and pleural, symptoms such as that. And I never even really thought about autoimmune disease in that population. And then when I went and read, actually, it does have this bimodal peak, and it does happen. Yes, it's less common in men and Hispanics, but it does still occur, so sometimes we get a little tunnel visioned and, who we're looking for things in. So I think that's kind of a good example. So, well, great. Summer, anything else you want to share, or what do you think is, how do you feel about your future?
Yeah, it's hard. Some days I'll say, I know that one thing that has really affected me is the possibility of never having children, being 27 and being told that it's probably not a good idea, not only for my body, but for also spreading Loeys Dietz, the connective tissue disorder that I have, has been a hard thing to really wrap my head around. It's not what I would picture for my future, but I think having the resources that I have with you and with Dr. Barron and spreading that and trying to help other people in my situation is what keeps me going, honestly.
I agree.
That it's hard for young women, and I've joined that. There's like a connective tissue disorder young support group,
Mhm.
and they struggle with the same things that I struggle with. And so it's been helpful to have a support group that really understands what I'm going through and try to help others understand that too.
I agree. How about pain? I think that's something with your
Yeah.
connective tissue disease, with any autoimmune condition, which there's a lot of overlap between those things. But I think sometimes people don't understand that sometimes you just don't feel good. And when we tried to say like, oh, you don't even have any of this Loeys Dietz stuff, even I was like, well, I think just like worry about it whenever you need to worry about it. And then we really started reading, you have almost every symptom, honestly.
Yeah, I mean, I could think of being a young kid, young adult, and having all of this pain in my hips and constant headaches and just joint pain. And, I've always just kind of thought like, well, I'm kind of long and lanky. Maybe it's just growing pains. I really don't know. But as I'm getting older and I'm learning more about the connective tissue disorder that I have, I'm realizing that a lot of these symptoms I'm having every single day are from the Loeys Dietz. I struggle with sleep from my body pain and things like that, but it's rough.
It is.
Yeah.
It is. And we've talked about, maybe dietary, that, really we're looking at what's inflammatory and trying to stay away from foods that are going to worsen inflammation. But, while working 80 hours a week and trying to make sure that we meet everyone else's needs, being able to focus on yourself is sometimes just a challenge.
Yeah. But I think, I wasn't able to, and I'm still not able to, just kind of turn my life over on a new leaf where I'm eating nothing but, good foods and exercising every day. But the small steps that I take each day really do make a difference in how I feel physically and emotionally. So I'll keep doing that and supporting, motivating other people to do it as well.
Great. Well, thank you guys. Ladies, you guys have anything else to say? I think that was great kind of introduction. And Summer, thank you for being our guest too and talking about your personal journey. It's private and it's not always easy. I've kind of pushed you a little bit to be an advocate, but it's great for me to watch you come into your own. And really, I remember when you were just a fry girl, for a lot going on there, both professionally and personally, of growth. So we encourage growth here in all ways, And thank you, ladies, for fighting the fight out there. I mean, I love the role that you're playing with Dr. Barron and your institution and the support that you give us and our patients. People ask, like, how do I practice in rural, in this rural area? I mean, sometimes I'm literally like, I'm a glorified, like, connector of care. I'm answering phone calls, telling this person they need to go to this hospital. This person needs this specialist. This person needs that. In many ways, as much as my knowledge and my skills are important, my connections have made a major difference for this area. When I came out here, I came from a busy place in Florida, 20 minutes outside Orlando. I grew up in a rural area outside St. Louis. And I knew that if I was going to succeed at building a quality cardiovascular program out here, I had to know where the doctors were in the different areas when I couldn't handle something. And some things happened by purpose. I mean, I made sure I went to Lubbock. I met the CT, and some things happened by quote unquote accident. I don't believe in that. I believe in God helping connect us when he thought we needed to. So I appreciate all those connections, and that's really, we're making a difference in lives out here. And I just want to say thank you to all of you guys for joining me and I'm happy to continue collaborating in the future.
Thank you for having us.
Yes, thank you for having us.
Great. Have a great day, everyone. Let's finish the week strong, and we'll get together again soon.